All right, let's talk a little bit about self-care and injury, or how self-care views injury. So generally, we will take a look at injury of the body, knee pain, back pain, these kind of things, and we'd say that this resides in the physical realm, the body realm. So you generally go and see a physiotherapist, personal trainer, maybe osteopath, maybe chiropractor, maybe massage therapist. These are all ways of addressing the physical body. And then we'd say, well, what if it's not a physical pain, but it's a mental pain? Then we'd go to a psychiatrist, maybe a lifestyle coach, maybe an elder, maybe go and learn something new. These are kind of ways to address the mental pain. But then what if it's not really a mental pain, but it's more of an emotional pain? Where would you go specifically? Don't really have a thing for that. We tell you to go to the exact same people, more or less. For the mental pain, you go for the emotional pain. Or maybe if you're a little bit more into it, you might do things like energy healing, or sound healing, or vibration style things, which generally seem to be a little bit more energetic in nature. But do we have anything else there? Not really. And so you can see our model is this one of treating the different pieces of health very separately. And self-care does not really address health in this way or injury in this way. Self-care would say that we are looking for the disruption of restoration in the individual. So is there some kind of pain that is not healing itself, physical, mental, or emotional? And if so, then we're going to apply the self-care technique appropriate to either the physical, mental, or emotional aspect of the person or the individual. Through my many years of being in the health, fitness, exercise, coaching style stuff industry, I have never once seen an injury that was not all three. We just generally like to prescribe one of the three. This makes it seem like it's more focused care, but it is more of an incomplete and fractured way of taking a look at the whole individual. So we'd say that self-care would be always addressing all three. The one that's most prominent first, then the secondary ones. It's good to note that when you combine these things into one practice, self-care practice, restorative therapy, if you will, you realize that you cannot heal the physical body, let's say, without addressing mental and emotional. That's one way to say it. But also that you cannot heal physical pain with physical things, if that makes sense. There's always something that caused it that was not physical in the beginning. So you have to address that. And this is kind of how that plays out. So when we're looking at restorative therapy, we are looking at anything that's hindering the body, the body's ability to restore itself, and also then looking at, the combination of addressing this thing as a whole in the individual. That would be a better way to understand self-care and injury. Thank you for listening.